Have you ever woken up in the middle of the night with a searing pain in your big toe, so intense that even the weight of a sheet on it seems intolerable? This sudden, throbbing pain could be the result of a condition known as gout. Often mistaken for other ailments, gout is a form of arthritis that affects millions worldwide. Gout is triggered by the buildup of uric acid in the body, leading to the formation of sharp, needle-like crystals in the joints. These crystals cause the intense pain, redness, and swelling that are characteristic of a gout attack. Recognizing the signs of gout is crucial. By catching it early, you can initiate treatment promptly, helping to prevent future attacks and potential long-term damage to your joints. Awareness is your first line of defense against this painful condition. Stay tuned as we unravel the 5 signs of gout you need to know. The first and most common sign of gout is intense joint pain. This isn't just your typical aching joint. We're talking about a pain so sharp and sudden, it can wake you up in the middle of the night. It's as though your joint is on fire. Gout has a particular fondness for the large joint of your big toe, but it doesn't discriminate. This pain can strike in any joint, your ankles, knees, wrists, fingers, and more. Now let's talk timing. The pain isn't a constant companion. Instead, it has a tendency to hit its peak within the first 4 to 12 hours after it begins. It's like a surprise party you never wanted to attend. But the pain doesn't stick around at its peak intensity. As time passes, the severity of the pain will gradually decrease. However, some level of discomfort may persist. Now onto the second sign. Lingering discomfort in your joints could be a sign of gout. Now, what do we mean by lingering discomfort? Well, once the initial wave of intense pain from a gout attack subsides, you might think you're in the clear, but that's not always the case. You may still feel a certain degree of discomfort in your affected joints. This discomfort can stick around for a few days or even a few weeks, and it's not just about the duration, but also about the progression. With each subsequent gout attack, the discomfort may last longer and spread to more joints. It's like a ripple effect, starting from one joint and gradually affecting more. So if you're experiencing lingering discomfort in your joints, especially after an episode of severe pain, it's important to pay attention. It could very well be a sign of gout. But don't worry, there's more to learn. Let's move on to the third sign. Inflammation and redness in the joints are another sign of gout. Now you might be asking, what's going on here? Well, the answer lies in the body's response to the deposition of urate crystals in the joint. When these crystals accumulate, they trigger an inflammatory response. This inflammation is your body's attempt to protect itself, but it can also cause discomfort and visible changes. The affected joints may become swollen and tender, often feeling warm to the touch. But it's not just about how it feels. Inflammation also changes how the joint looks. The skin over the joint may turn red, a telltale sign of the body's ongoing battle against the urate crystals. Remember, gout is more than just pain. It's a complex condition that can visually manifest in several ways. So keep an eye out for inflammation and redness, especially if it's accompanied by other signs we've discussed. Next, we'll look at the fourth sign of gout. As gout progresses, you may find it difficult to move your joints normally. This limitation is not just a minor inconvenience, it's an indication that gout is becoming chronic. Over time, the frequent bouts of gout can lead to a long-term condition known as gouty arthritis, a form of degenerative arthritis. Imagine waking up one morning and finding that bending your knee or flexing your wrist is no longer a simple task. It's like your joints have forgotten how to dance to the daily rhythm of life. This limited range of motion is a sign that the uric acid crystals are accumulating in your joints, causing damage and hindering movement. It's important to remember that gout is not just a one-time event. It's a progressive disease that can worsen over time if not properly managed. So if you're noticing that your joints aren't as flexible as they used to be, it's time to take action. Finally, let's explore the fifth sign of gout. The final sign of gout we'll discuss today is the appearance of hard, pea-sized lumps under the skin. These lumps are known as tophi, and they're not just a random occurrence. They're a sign of chronic gout, a stage of the disease that can lead to more severe health issues, including joint damage. Now let's get something straight. These tophi can pop up anywhere in the body. It's like they have a mind of their own, but they tend to play favorites. They're commonly found on the fingers, elbows, and even the ears. It's like they're playing a game of hide and seek. only they're not very good at hiding. These lumps are a clear indication that gout has been a part of your life for a while, and it's time to take action. Don't let gout call the shots. Recognize the signs and take control of your health. That wraps up the 5 signs of gout you need to know. In summary, the 5 signs of gout are intense joint pain, lingering discomfort, inflammation and redness, limited range of motion, and pea-sized lumps under the skin. These symptoms are not to be taken lightly. If you or someone you know is experiencing any of these signs, it's essential to seek medical advice promptly. Early treatment can significantly help manage these symptoms and prevent future attacks. Don't be a stranger to your doctor's office. It's always better to err on the side of caution when it comes to your health. Gout is a manageable condition, and the first step towards managing it is recognizing the signs. It's about understanding your body, knowing what's normal and what's not, and then taking the necessary steps to ensure your well-being. Remember, recognizing the signs of gout is the first step to managing this condition. Thank you for watching, and remember to take care of your health.